So I think there's a lot of different variables and benefits for the QC. I joined the QC about 4 years ago because it's a quality collaborative with an emphasis on quality improvement. And I had studied in business school the terminology or Kaizen, which is continuous process improvement and quality improvement. And I thought the QC is a perfect fit for hernia and quality improvement. And that's why I initially joined. And I think I get that. And that's a value that I get. But what's been really interesting is I get that not just with the meetings and the QI summits, but I also get that with conversations that are sidebar conversations we have at the meetings. Understanding sometimes which sutures are better than others, which approaches are better than others. Some of it you get by attending meetings, some of it you get by the informal relationships that I've made. And I think the most unexpected value for me and for surgeons is there's a huge sense of camaraderie. So everyone in the QC is passionate about hernias. And they're also passionate about building other people up. It's just, how do we get better and how do we help others get better?
I think the ACHQC is actually a very beneficial platform for surgeons to be able to follow their outcomes. One of the things that sometimes we as surgeons don't get to really do is really follow our patients' outcomes after their hernia surgery. We might see them initially after their post-operative visit, about 2 to 3 weeks, but oftentimes we don't follow them up. And it helps us to actually see longitudinally how well they are doing. Helps us to actually evaluate our own outcomes versus other outcomes for other surgeons.
Not only do we get to put in our information and see how we are doing with our own care of our patients, but also we get to use kind of the collective group experience to then go back and take a look at how patients are doing with the specific interventions that we've offered them. And then based on that, we can figure out any types of clinical changes that we want to make. And then not only that, we have the potential and the capability of doing process confirmation. Not only are we finding trends and ways to change things for the better care and quality of our patients, but we then get the opportunity to go back and follow up on that and see if it worked.
Well, I think the membership allows you to distinguish yourself by showing to the patient that you really focused on providing the highest quality, highest value hernia care. I mean, for someone that's committed to the organization, it means that they're really looking at their data, they're following their outcomes. And so when I talk to my patients, I explain that to them, and I say to them that, this is a good way for for my outcomes to be followed and for them to follow you to make sure that, I'm providing the highest quality care to you. So I'm pretty frank and honest with my patients, and I think that's why the collaborative really distinguishes me. It puts me in a different league to my colleagues in the area that may not be necessarily using the collaborative.
I think that what's special about the summit is that the size of the conference really allows you to get to know the attendees, from tips to tricks to talking about wanted research questions that need to be answered in the field, to meeting in small groups. I think was really an extraordinary experience.
Another thing that I think is tremendous is the ACHQC Quality Summit that we have every year, where we can get together and talk about the changes that we're making in our clinical care for our patients. And I think those sessions tend to be just so engaging, and we learn so much from each other in such a supportive environment. And I think that's something that's just so unique about this organization, and honestly is one of the most exciting things to me as a surgeon every day, just in terms of not only do I get to enter my data and share with others, but I also get to learn from them as we go along. And that is really an invaluable resource, I think, to every surgeon.
About 2 years ago, I heard a presentation on opioid usage, and at that presentation, it talked about the sort of standard of care that they were coming up with and how many pills patients were using, and the average patient was taking 5 to 7 pills, and then I was prescribing 30 pills. So when I came back from the summit about 2 years ago, I changed my pain prescribing behavior by taking some of the information from the QC Summit and applying it to my practice, it provides better care for my patients and provides more, I guess, state-of-the-art and up-to-date care for patients. This year, I've also, based on some of the presentations on just technique and, hearing, whether it be a simple umbilical hernia or whether it was an inguinal hernia, just some of the best practices that some of the very high volume surgeons that do this at universities, when they talk about their technique, I think, again, I try to keep an open mind and say, can I implement something that they're doing into my practice? And, even if it's, 0.1% improvement in our outcomes, I think that's real.
What really stood out was the opioid reduction initiative. It was great to kind of see what everyone is doing around the country and then listen to the new initiative and really get some hard recommendations on how many narcotic tablets, oxycodone, to essentially give for various procedures. I was surprised at, the number being very low. I knew it was low, but it's nice to actually see the numbers, which I have definitely implemented into my practice. We can talk, for years about is how to fix an umbilical hernia. It was really great to see a lot of surgeons talk about their various technical approaches. And I think what I'm doing more is actually doing open approaches to umbilical hernia repair. It was great to see some various techniques, definitely smaller size, but definitely have implemented that into my practice after attending this summit.